Hello everyone, very good evening to all of you. So today I will be talking about a topic that really troubles us, that really baffles us at an undergraduate level for NEET PG level, something which we don't have too much clarity on. Well, let me tell you, even a lot of general surgeons practicing this surgery also have little difficulty. So in today's class I will try to simplify it. Okay, let's simplify inguinal anatomy so we understand what all possible questions can pop up from this topic. Okay, so whatever doubts you have, you can ask me. I can see your messages in the YouTube chat box and I will be happy to solve them as we go along the class. Alright, so those of you who are coming for my class for the first time, let me introduce myself. I am Dr. Amrit Nasta. I am a bariatric surgeon from Mumbai and I am your surgery educator on the Unacademy platform. You can download the Unacademy learning app where you can follow me on my profile as well as the profile of a lot of educators who teach on the platform who will help you with your preparation for all the upcoming entrance exams. This month a lot of batch courses started to target for entrance exams like NEET PG 2021, which will be in less than a month's time, FMG entrance exams and so on. So if you wish to learn from these educators on Plus, you should subscribe and remember this is the code to use 10 surgery. This code will get you a 10% discount on whatever subscription plan you choose. And apart from subscriptions, there are a lot of free tests which are going on, a lot of special classes. I just took a special class little while back where we discussed some important image-based and clinical scenarios for our entrance exams. So all these free things you should definitely take full use of, as well as the subscriptions. Now there are two subscription plans. There is a Plus plan and there is an Iconic plan. On Plus you get live classes on the app, you get batch courses like I told you about. On Iconic you get benefits of Plus as well as Prep Ladder, where you get recorded lectures, handwritten notes and so on. So there are a lot of different subscription plans. You can opt for whichever exam you are targeting accordingly. You can take a longer duration plan. Remember, this is the code to use, or you can take a shorter plan of 1 month, 3 months, 6 months. This is the code to use, 10 surgery. Whatever plan you choose, if you apply this code, you will get a 10% discount. Remember, the Iconic plan is for 1 year duration minimum. So choose your plan accordingly. Okay, so let's begin today's session on laparoscopic groin hernia, and I'm calling it groin hernia for a reason. Okay, I'm calling it groin hernia for a reason. Open inguinal hernias I have already covered in my YouTube session. So open hernia, you can watch my YouTube session. It's called hernia surgery step by step. उसमें मैंने पूरा cover किया है. Now we are going to talk about something which is a little more difficult. I will try to simplify it. And after today, a lot of questions on this anatomy and these procedures will become a little easier. I guarantee it. It will become a little easier. This is a short class, so let us try to cover as much as possible. Now, when I plan a lap groin hernia repair, and I'm calling it groin for a reason which you will see, I'm not calling it inguinal. Conventionally, there are two approaches. Anybody can tell me what are those two approaches? By approach, I only mean start. How do I start the surgery? Yeah, a lot of people are there on chat. Anybody wishes to tell me? Sandeep, Aisha, and so on. Yeah, Sandeep, hello, Aisha, who was there in my special class just now. What are those two approaches? Just the approach means how do I start the two surgeries? They are both for groin hernia only. One approach is called TAPP. Other approach is called TEP. Okay, TAPP stands for transabdominal pre-peritoneal pre-peritoneal. No, not open or laparoscopic. We are talking about laparoscopic only. Open I have already done. So transabdominal pre-peritoneal, and the other is totally extraperitoneal. Now understand, these are just the approaches. By approach, I mean this is just how I begin the surgery. The surgery that I'm going to do in both is the same. It is just how I begin that is different. Okay, just the starting is different. The surgery is the same. Now what do I mean by starting is different? I'll make it very easy. Okay, let's see the abdomen from the side. Okay, you are seeing the abdomen from the side. Let's say this is the xiphi, this is the umbilicus, and let's go lower down. Somewhere here will be the pubis. Okay, and here will be the groin area. Now when I am doing transabdominal pre-peritoneal, understand your abdomen has a lot of layers: skin, subcute, then it has the muscles. Okay, I am just trying to be a little graphical so you understand what's happening. So then you have the muscle layers: rectus sheath, rectus abdominis, then you have fascia transversalis, then you have the peritoneum. Okay, this is the peritoneum, and this is the intraperitoneal cavity where you have the bowel and so on. Now when I talk about transabdominal pre-peritoneal, the first one, ye wala surgery, how do I start? When I do this surgery, I enter transabdominally. Means what? I cut the skin, cut the muscles, and I put my laparoscopic trocar into the peritoneal cavity. Okay, this is how I start. So my instrument enters the peritoneal cavity. This is the peritoneal cavity. I have gone through the peritoneum. So I'm inside the peritoneal cavity. Okay, this is the bowel. Understand, this is where my hernia is going to be, somewhere in this area. Now what I do is I look this side. Okay, I look over here. I cut the peritoneum. Okay, so I'm looking up and I'm cutting the peritoneum. After I cut the peritoneum, I make a hole in the peritoneum. Then I enter the pre-peritoneal plane. So this was my peritoneum which I cut. Okay, I cut it over here, and then I put my instruments through this hole into the pre-peritoneal plane, and I go down in this area and I go and treat the hernia. This is called transabdominal pre-peritoneal. I enter the abdominal cavity, look at the peritoneum on top, cut it, and enter the pre-peritoneal plane. Understand, when I do open hernia, when I am doing open hernia, inguinal hernia, I directly go from the skin above the muscles. I am above the fascia transversalis. I never go deep to the muscles or deep to the fascia transversalis. Onlay repair, right? Onlay. Here I am deep to the fascia transversalis. I am in the pre-peritoneal plane. This is the plane where I am operating, pre-peritoneal. So this is how the starting is going to be little different. So I hope I am clear. This is how I start when I am doing a TAPP, inguinal hernia repair. This is TAPP. This is only the start. I go in the abdominal cavity, cut the peritoneum, and go in the pre-peritoneal plane. Similarly, now let me tell you what is TEP, or totally extraperitoneal. Now when I do TEP, थोड़ा ही difference है, ज़्यादा difference नहीं है. The difference is very little. Here what I do is I put my instrument, so I cut the skin and I put my instrument straight away into the pre-peritoneal plane. I don't cut the peritoneum at all. I don't go inside. I go straight into the pre-peritoneal plane, and then I go down like this, and I go towards the inguinal area and I do the surgery. So in TEP, I never enter the peritoneal cavity. That's why it is totally extraperitoneal. Am I very clear on this? This is the only difference between the two. Only the start. In TAPP, go inside the abdominal cavity, see the peritoneum, cut it, and go pre-peritoneal. In TEP, remain pre-peritoneal. So it is called as totally extraperitoneal. So it's only the start where the surgeries differ. Surgery is going to be the same. Now I go over here, I treat the hernia, reduce the hernia, and put a mesh. That is what I am doing in both. And in both, I am going to be deep to the fascia, deep to the muscles. Why to do TAPP? TAPP is technically easier. It's a technically easier procedure. It's only the start, which is more effective. Both are equally the same, because in both the surgery is the same. In both, I will remain in the same plane. So the outcomes of both are the same. Only TAPP is something which is little easier to perform. You get more space. That is the only difference. Now let me give you a brief idea about when I am in this pre-peritoneal plane, what am I going to see. So this is different. This is where the difference comes between open hernia and laparoscopic inguinal hernia. Okay, I am in the pre-peritoneal plane. So now I'm looking straight like this. My camera is over here and I'm looking in this area. Okay, with the peritoneum below and the fascia and the muscles above. This is what you need to understand. This is where I am and where I'm looking forward, looking down towards the inguinal region. So simply put, in the center will be the pubic symphysis like this. Okay, ऐसे होगी pubic symphysis. This is what I see. Up front there will be pubic symphysis. Then at the floor there will be the peritoneum. At the floor, because I am in the pre-peritoneal plane, so niche will be the peritoneum. I am in the pre-peritoneal plane, and at the roof on top, at the roof upper is going to be the fascia transversalis and the muscles, abdominal muscles. Let's just leave it at that. Okay, so I am in between these two planes, fascia transversalis and the muscles above, and peritoneum below. Now I'll tell you what all structures do I see. Now you will need the actual anatomical understanding. Okay, so now this is the anatomy. This is the pubic symphysis. This is the pubic tubercle over here. This is the left side. This is the midline, and this is the right side. Okay, this is the right side. Now understand, when I'm doing open surgery, I have the inguinal ligament. When I'm doing it laparoscopically, the inguinal ligament which goes like this is the inguinal ligament. It is going like this, which I am seeing laparoscopically, is called something else. Anybody knows what it is called? The inguinal ligament, when it is seen laparoscopically, it is not called inguinal ligament, it is called something else. Again, it is going from pubic tubercle, यहाँ पे ASIS होगा. What is it called? When I am seeing it laparoscopically, it's called the iliopubic tract. Okay, it's called the iliopubic tract. इतना ही समझना है. So this is the pubic symphysis, pubic tubercle, iliopubic tract. And now I am seeing pre-peritoneal. Roof, I already told you, roof will be the fascia and the muscles, and the floor, this area, will be the peritoneum. And I am in between the two. No, it's not Cooper's. It's not Cooper's. Alright, so I am in the pre-peritoneal plane. The rest is very easy. Once you have understood this anatomy, that there is the inguinal ligament or the iliopubic tract, fascia and muscles superficially, and peritoneum deep, and you are in between, this is where the hernia surgery is going to be performed. Now, what all structures do I need for understanding? So we look at the roof first. The first structure that we see is this. These blood vessels. They are my inferior epigastric artery and vein. They are seen at the roof. Inferior epigastric artery and the vein. Now you know, when we do open hernia, a hernia which is medial to the inferior epigastric artery will be a direct hernia. Hernia which is lateral to the inferior epigastric artery will be indirect hernia. ये तो अपने को मालूम है. So medial, if I see a hernia, it is going to be a direct hernia. Lateral hernia will be indirect hernia, and obviously it will go through the deep ring. So what I see is going to be in relation to the inferior epigastric vessels. This is the first landmark that I need to identify when I am talking about the hernias. Is it a direct hernia? Is it an indirect hernia? So pehle I will see, okay boss, where is the inferior epigastric artery? Is the bulge medial to it? Is the bulge lateral to it? Fine. So this will be direct, this will be indirect, this will be deep ring. Now when I am seeing pre-peritoneally, the deep ring, from the deep ring two structures come out. One structure is going to be this. This is my vas deferens. It is basically the spermatic cord, correct? Spermatic cord has vas deferens and all those other structures, testicular vessels, all those things are there. They are in the spermatic cord. Now when they come out from the deep ring, they split. So medially will be the vas deferens, laterally will be the testicular vessels. So these are the testicular vessels. This triangle that is formed between the vas deferens and the testicular vessels, this triangle is called triangle of doom. correct? This is called triangle of doom. Why is it called triangle of doom? Because deep in this triangle are these big blood vessels. They are your external iliac vessels. So this is triangle of doom with the external iliac vessels in the depth. If I go lateral to it, okay, if I go lateral to it, this is where they asked a question in AIMS. If I go lateral to it, so understand, this was the vas deferens, these were the testicular vessels. Lateral to it, which means testicular vessels over here, and you know what the structure is. I told you at the start, inguinal ligament or iliopubic tract. This triangle between the testicular vessels and the iliopubic tract, this triangle is called triangle of pain. Why is it called triangle of pain? Because in this triangle you have a lot of nerves running in the pre-peritoneal region. So this is my triangle of pain. So if they ask you what are the boundaries of triangle of doom and triangle of pain, which is one of the popular questions, now you will never have a problem. You just need to understand this basic anatomy, right? You just need to understand this basic anatomy. That triangle of doom, which is the more medial triangle, it has vas deferens medially and testicular vessels laterally, and it contains the external iliac vessels. Triangle of pain will have testicular vessels medially and iliopubic tract laterally. This is triangle of pain, and this contains the nerves. This contains the external iliac vessels. This is my triangle of pain, triangle of doom, both are next to each other. Fine. This is part 2. There is something called as corona mortis. Anybody knows what is corona mortis? Any idea what is this corona mortis? If you know this, then 90% of your job is done. 90% job is done. Anybody knows what is this corona mortis? Any idea? बस ये एक ही चीज है. The rest of the things are easy to understand. Yeah, what is this corona mortis? Any idea? So sometimes in some people, the iliac vessels have a communication with the inferior epigastric like this. So your external iliac communicates with the inferior epigastric. This is called corona mortis. Corona means crown. Mortis means something that can kill. So a vascular communication between the iliacs and the inferior epigastric is your corona mortis. These are the only things that you need to know. Yeah, accessory obturator, which comes usually from the inferior epigastric. Excellent answer. ये हो गए हमारे 3 landmark. Now, what all hernias do I treat by this approach? So once I have reduced the hernia, this hernia is reduced, this hernia is reduced, then I will place a mesh in this area. Okay, I put the mesh, end of the story. So what all hernias can I treat? I can treat direct hernia over here. I can treat indirect hernia. Is there any other hernia I can treat? By laparoscopic groin hernia surgery. Is there any other hernia that I can treat? Any other hernia? Because both of these hernias are going to be above the inguinal ligament. Remember, there is a hernia over here also, which is below the inguinal ligament, which is little medial. What hernia is that? Below the inguinal ligament medially, which can be seen in this approach. That is your excellent, that is your femoral hernia. So remember, I called it groin hernia for this reason. Because by this approach, both direct, indirect, as well as femoral hernias can be treated. Whether I do TAPP or TEP, those are just the starts, but these 3 hernias can be treated. Yeah, and rarely there is a rare hernia called obturator hernia that can also be treated. But these are the 3 main ones that we need to know. Okay, now easy way to remember the anatomy. I'll tell you very easy way. This you should copy while I am doing, or you draw it later. Easy way to remember. This is the anatomical diagram you should make. Okay, I'll just take 1 minute to draw that. Once you draw that, it becomes easy. Now in the midline is the pubic symphysis. Okay, this is my midline. So I have pubic symphysis. From the midline on both sides, you draw this line. This is my inguinal ligament or Iliopubic tract. Iliopubic tract. So this is going to be left side, this is going to be right side. This is iliopubic tract. Correct? Now I told you, ऊपर will be roof. This area is the roof. ऊपर is roof, नीचे is floor or peritoneum. ये तो मैंने पहले ही बताया. On the roof, you are going to draw inferior epigastric on both sides. These are the inferior epigastric vessels. Now come down. Come down. Medially, I will draw the vas deferens. Medially, I will draw the vas deferens. So this is inferior epigastric artery, vas deferens. Remember, vas deferens goes medially. And laterally, I will draw the testicular vessels. Okay, I hope you are following what I am doing. If not, please see this video again and just follow this. Testicular vessels go laterally. Bas, itna hi ho gaya. Now, where will I get direct hernia? Direct hernia will be over here. This is my site of direct hernia. Where will I get indirect hernia? Over here. Indirect. Lateral to the inferior epigastric vessel. This will be indirect. Right? This triangle here between testicular vessels and vas deferens, this is triangle of doom. Testicular vessels, vas deferens, triangle of doom. Lateral to it on both sides. Lateral to it, this triangle over here. This is going to be triangle of pain. This is going to be triangle of pain. Bas. That's all we need to know. Femoral hernia will come over here. Femoral hernia. Femoral hernia. These are your 3 hernias. This is how you will tackle. If you have understood this, never in your life you will have any problem in understanding the anatomy of the laparoscopic inguinal hernia surgeries. Okay? If you didn't follow while I was drawing, watch this video again. Watch it at normal speed and draw as I drew. This is the anatomy that we need to know. Midline, left side, iliopubic tract, inferior epigastric vessels, vas deferens, testicular vessels, triangle of pain, triangle of doom, and the 3 hernial orifices. And my mesh is going to be placed like this. If it's on the left side, it will be placed like this. This will be the placement of the mesh. End of the story. Okay, so I have really simplified this difficult inguinal anatomy. If you have any doubts, you can ask, and this is my Telegram group where you can contact me if you have any details. If you wish to subscribe to Plus, this is the code to use, 10 surgery. Do remember to like this video, and in 5 minutes time I am taking another class 8:30 on GCS. I have shared the link already. GCS Made Easy. That is also going to be a short class. Do join me for that as well. Okay, so hope you guys enjoyed this video. If you have any more problem, just see this last diagram that I drew. Just draw it with me in real time and your life will become really easy. Okay, that's the idea. So take care guys, have a good day.